Okay. I guess I'll start. I sent out some agenda items. I think I don't know whether we want to do the questions first, but it might, or the questions last, the high cap questions. But other than the high cap questions, what I wanted to go over is whether we wanted to meet in 2 weeks or 4 weeks and to have some discussion about how we might handle open enrollment, what people are willing to do for open enrollment, because I'm sitting here counting, and of the people that are on, a quarter of them can't work with us in open enrollment other than remotely, possibly. And I don't know what we can do. I think we have to discuss it, because if we make a commitment to libraries for people to do it, we need to know that the volunteers are there to handle the load we might get. So that's a topic for conversation. And as I said, the questions. So just where would everyone like to start? Would you like to start with the high cap questions and get that all out of the way?
Yes.
Yes.
Okay. So I guess, Vaughn, it's up to you. Do you want to?
Sure, I'll share my screen and we can go over it all as a group. Give me 1 second to load that up.
Okay.
All right, so I showed him. So I'm gonna do the hot finish the exam. I want to know just where you are so far.
Oh. You're not clear.
Oh, can you hear me now?
There's like a big buzz behind you.
And the print is too small.
Good. Good. So you guys, can you hear me correctly?
Very bad audio.
Yeah.
Give me 1 second. I'm gonna switch to my headset. Is that better?
No.
No, still bad.
I think you have two items on, and we're getting reverb.
Okay. Let me see if I can fix that. Any better? Any better?
Yes.
Not great though.
Not good.
No.
See what else I can do to make it any better. It's not like I'm covering anything. I'm not sure.
Try muting the Zoom session.
Yeah, I think you'd have to do that.
Nope,
No, very bad.
that's worse.
Yeah, if Vaughn can call in perhaps and just close the audio, just call into the meeting on his phone and we can get it that way. Or else Loretta, could you run this thing and then he can add comments?
Could I read over the test?
Yeah, instead of him, because your audio works.
Okay.
But better if he just calls in and uses.
I don't know, do you have the? I'm not, you want to share your screen, Vaughn? Or I suppose I could bring up copy. I'll bring up my copy.
It is.
Okay, I could work off of Vaughn's copy. Okay, question 1, the maximum out-of-pocket limit that all Medicare Advantage plans have after which they cover 100% includes which of the following? Part D, drug benefit, monthly plan premium, extra benefits, A and B covered services.
Last one.
Yep, correct. Medicare beneficiaries was part, I mean, I don't even know if I have to read this other than, I mean, do we want to just read through them and?
Just read the question perhaps and not all those answers, you know. that gets-
I'm sorry, I'm trying to scroll over here and wondering why I'm having no effect. Sorry.
Read the question. Read the question, but not the answers. I'm sorry.
Medicare beneficiaries with Part A only may still be eligible for
The last one?
Yeah, those 1 and 2.
both one, and two. Correct. Outside of the public health emergency, most people with Medicare that receive the following have to recertify their eligibility each year. We talked about this last week.
Right.
All of the above.
No,
No.
savings programs.
Dave, Marna and I got that wrong too. It's a wording question there. It's a way they worded it, and something about the automatic nature of extra help or something like that. Somebody can clarify what the answer, but everybody got that wrong when we were playing around with it.
Yeah, well, I'm still not clear which ones automatically do, but that's exactly what what Julie said. Beneficiaries with extra help whose plan is terminating or with full LIS whose plan is no longer a benchmark plan may receive which color letter from CMS notifying them that they're being reassigned for the next plan year?
Blue.
Blue, correct, blue. In New York State, we do not have the following in relation to Medigap insurance.
All of the above.
Right.
Yeah,
Which are requirements for Epic?
Age 65 and over.
yeah,
No. Which of the following is not, that's true, correct. Which of the following is not true about a part transition fill?
Available.
yeah, I put available for new drug in middle of year.
Yep.
Right.
Yes. Medicare eligible federal retirees covered under the Federal Employees Health Benefits Program elect
Any of the above.
any of the above.
Yeah.
See them.
Which is not true of the January to March 31st Medicare Advantage open enrollment period. Allows
The
benefits
third one down.
from original Medicare to Medicare Advantage plan.
Could I go back? I have a question about 8.
8,
Yeah, if you have, federal employee health benefits and you don't elect Part B, will you be subject to a penalty if you later want it?
So
think
the answer is yes.
Yes.
Yeah, that's what I thought. That's kind of a tricky question.
well,
Thank you.
we're up to,
So actually, can everyone hear me now?
Yes.
Yeah.
Yes.
Okay, great. Sorry about that. Thank you for taking over. I really appreciate it. The trouble was that it took me so long to get in. So yes, regarding the FEHB program, you can have both. You can have one or the other, but they don't interact necessarily. So you can't use one to use coverage for the other. So you will have a penalty. You can decide that you want to have your FEHB benefits, but they don't cover you in terms of the penalty. It doesn't cover the gap, really.
Thank you.
Question 9, which is not true of the January 1st to March 31st Medicare Advantage open enrollment period?
The third one down. That's it. No,
Correct. Yep. Everyone else got that answer too?
Yes.
Yeah.
Third one? Okay, great. Question 10, the 5% New York State limiting charge does not apply to.
the second one, home and office visits.
No, it's all of the
All of
above.
the
So I
above.
believe this one was all of the above.
Oh,
You were going to look into that because we had some, we didn't know where to find that. I'd love to see that in writing.
Right.
So we weren't able to find it on any of the official documents, but we were able to find it on a specific Medicare website that said so. It wasn't a .gov website, or it wasn't anything that was sanctioned per se, but we couldn't find exactly where it said that. So we'll have to take more time to go over that.
It's the particularly that not that, the home office was correct, right? But it's the ones from the non, outside of New York, that's where I'd like to see it written.
Say it again?
Some of them, we do know, we can find validation for. It's, I think, the third one, the services provided outside of New York.
Mm-hmm.
And maybe even the first one. Those ones I'd like to see in writing.
I have to admit, I'm still a little confused about the office visits piece. If the doctor accepts assignment,
Because there's two carve-outs in New York State, which Eric Hausman told us about in one of his detailed presentations. We had always assumed New York State is 5% for everything, but it turns out it's 5% for everything except 15% for an office or a home visit, and it has to be coded specifically that way.
And it's quite literally everything except that.
so that but what is the everything then? If it's not the office visit? Is it everything that happens during the office visit?
That's all 5%.
Yeah,
Yes.
okay, that's the distinction. Got it.
They would bill the office visit, like on the bill when they code it, they would bill office visit, and then they bill the different things that they did besides that, what they actually did. That would be subject to the 5% New York State limiting charge.
But not if they accept assignment though, is that right?
right.
Okay, sorry to belabor.
Question 11, non-US citizens age 65 and above who do not qualify for a premium-free Part A must be a legal permanent resident for how many continuous years to become eligible for Medicare?
I
Fine.
said 10.
5.
5.
The answer is actually 5. Question 12, for both the high deductible Medigap plan and the high deductible, the high deductible Medigap plan F and the high deductible Medigap plan G, which of the following is applied towards the high deductible amount?
Said all of the above.
The answer was all of the above. All of these get counted towards that deductible when it comes to these high deductible plans, these high deductible Medigap plans. Question 13, which of the following covers a Medicare beneficiary for non-emergency care from Medicare providers throughout the United States?
2 and 3.
2 and 3,
Absolutely.
both 2 and 3.
Can I ask a question?
Absolutely.
in a Medicare Advantage plan that might have a $1,000 deductible, what counts towards that deductible? If you, or does it differ from one plan to another?
No, what counts towards that deductible would be anything that you're paying out of pocket. That's at least my understanding of it. It's anything that's coming out of your pocket that counts towards the deductible.
Okay.
But not drugs, because I
But
looked,
not drugs and not the premium.
And,
Yeah,
and you have to keep in-network and out-of-network separate. Potentially.
Right.
Okay, thank you.
Question 14, a new Part A hospital benefit period begins. Anyone want to take a stab at it?
none of
None of
the,
the
None of
above.
the above.
None of the above.
Easy.
Benefit period, as I'm sure you all know, begins when a person enters the hospital or a skilled nursing facility in inpatient care and ends when they've been 60 days free. 60 days SNF and inpatient care free. Question 15, which of these websites would you use for the indicated purpose? This one was actually a bit of a informational question, like I said last time, and the answer was, if anyone would like to say it.
all of the
All
above.
of the
All
above.
the above.
So you can find all of this information as it says. You can find the Part D plans using the plan finder. You could find the Medigap's. I actually have it saved right here. I use it very often. The Medigap plans right here on Department of Financial Services. You could also enroll individuals on SSA.gov. Question 16, all people that are Medicare eligible due to disability under 65 are?
I said the second one,
Yeah.
Me too.
automatically enrolled in both. Yeah,
I'm not certain. Give me 1 second. Absolutely. Question 7. Did anyone have a question regarding that?
Oh, it doesn't really say after 2 years of disability, but that's what's required.
But they say a Medicare eligible, which implies 2 years of disability, otherwise you wouldn't be eligible.
Right.
Question 17, veterans who receive healthcare coverage through the VA.
Second one.
No, it's actually that they cannot delay.
What?
No, for
I
Part D,
don't think so.
No, it's the same question as last year.
yeah, and they have creditable coverage under the VA benefits for drugs.
But they can't delay it. They will still, because they can completely decide to use their VA coverage. They can stay within the VA hospital system as long as they'd like. But once they decide to go outside of the VA system, they don't have coverage. And so they would be, if they decide to come back into the Medicare fold, there would be penalties for them. And
No.
No,
I'm wrong.
the answer is
That's
2,
important.
the second one.
Right.
On last year's
Okay.
test.
All right, well,
but it's the second one, isn't it?
Yes,
Yes.
Yes.
it's because the VA coverage, as long as it's been continuous, is creditable coverage.
Yeah, but if they decide they don't want to use that for something and they want to go into B,
Not B,
they
we're talking
better do,
D
they
is in
can't
David.
switch, in other words. Go on.
so yeah, I would have to agree with that. Like I was saying, when it comes to VA coverage, it's all good and well as long as you stay within the VA network.
Right.
Because that coverage doesn't work outside the VA network, and so it doesn't really interact with Medicare in that sense.
Right.
So you could, like I said, you could have VA coverage and be completely satisfied for the rest of your life, going to your local VA hospital and using all your VA doctors. But the moment that you decide you'd like to leave the VA system, you have to come into the Medicare fold, and you would not be, that would not count as creditable coverage. You would not
But
say
VA,
that
But VA drug coverage is creditable, so
Exactly.
the answer is 2.
Okay, so let's see what the answer is at the end, and then I'd be happy to.
Basically, I took the test and it can
It is
delay
too.
the enrollment in Part D.
Yeah,
I
Okay.
think it does too.
Happy to go. Question 18, which of the following is true about COBRA coverage and Medicare?
None of the above.
none of the above.
Absolutely. Question 19, Medicare beneficiaries who do not qualify for premium-free Part A cannot have.
Part A only.
Part A only was correct. Question 20, which of the following situations would qualify a beneficiary for a special enrollment period in SEP to switch their Medicare Advantage with Part D MAPD plan?
None of the above.
Absolutely. None of these give you permission or give you a special enrollment period to switch out of the plan. This is just, unfortunately, the bad luck of being in a Medicare Advantage plan. The physicians can switch out at any time, but you're kind of stuck. This doesn't count either, and this doesn't count either.
Yeah, can I just stress that because it's something that I got caught up on the wording with, or actually the concept of the provider stops in the middle of the year. And that doesn't give you the right to change your plan. Just that's a stress point. Just because they drop out, too bad. You have to find a different provider, not that you can't change your plan, but you just have to find a different provider.
Absolutely. That's something definitely to stress in your counseling when someone's deciding between using original Medicare or a Medicare Advantage plan, that you could love your physicians, but your physicians could decide they don't love your plan.
Mm-hmm.
And then you're kind of out in the wind for a little bit until maybe your next enrollment period when you can switch to something that they have if you're able to at that point.
Or if you had Epic.
Yes, or if you had Epic and you had an enrollment period like that. So in the first 3 quarters.
Mm-hmm.
Question 21, which of the following is not true about Medigap, Medicare Supplement Insurance?
The last one.
Network.
The last one.
Yep, there is no network.
Absolutely. So Medigaps, the beautiful thing about them is that they're all the same. The only difference, in my opinion, and I'm sure you guys have something to say about this as well, is that the only difference you're really paying for is in customer service. You're getting the exact same Medigap policy through all of these insurers, just charging you a different price. Question 22, beneficiaries in the following situations can delay enrollment in Part B without penalty.
Third one.
Yeah,
Yes.
Absolutely. Does anyone have any questions regarding 22? Silence is golden. Question 22, people with Medicare would contact the following with questions. On?
All of the above.
I said all of the above. Yeah.
Absolutely. This was another teaching question, really. All of these organizations that you see here, the BCRC, the ICANN, and the Levanta, are all places that you can do what it lists out right there. You can do the following. In 24, if a Medicare beneficiary signs an ABN,
I said all of the above.
that's absolutely true. You can still appeal even if you did sign an ABN. And the third option is exactly what an ABN is. You will be responsible to pay if Medicare denies it. Question 25, which is true of the SEP 65 special enrollment period available for beneficiaries who enroll into Medicare Advantage plan when first eligible for Medicare at age 65.
Number 2.
Yeah,
Allows beneficiaries 12 months to switch to original Medicare.
Right.
Was that wait? Okay, moving on. Question 26, in a Medicare Advantage PPO plan out of network, doctors in the Medicare program that do not accept assignment can charge up to
Part
So
B.
the second one, Part B, limiting charge.
limiting charge, and that was that 15%, I believe. Question 27, which beneficiaries would qualify for the Part B special enrollment period?
2.
Yeah,
Yeah, 2.
2.
Great, we're all in agreement.
Could you go back to 26 for a minute? You just
Sure
said
thing.
that would be 15%, but don't you mean also in New York State 5%? Or is it just 15% for that particular type of question?
So I believe when they say the limiting charge, they usually mean the 15%, but again, I could definitely be wrong. It could still be the 5%. This is what we're having this conversation for. Is there anything that you'd like to add?
Yeah, that one. I would like to clarify that. I would assume it's 5%.
Okay. Question 28, people with MAGI Medicaid through the exchange who later become age 65.
All of the above.
All of the above.
All of the above,
all
absolutely.
the above, yeah.
Question 29, if you are single, over 70, retired and collecting Social Security and have no health insurance, you must be enrolled in
Part A,
the answer actually
I'd
was
say Part A.
right.
Yeah, but Dawn, that was the one that the question is weird. If you are single, over 70, retired and collect, and have no other health insurance, you must be. So it's implying that Social Security puts you in A without, see, I don't understand that, really.
No, I think it's the opposite. I think it's saying because to qualify for Social Security, you have to have worked that long and therefore you're qualified for Part A.
Yeah, but the
Social-
must, capital letter must be enrolled in.
It's
You're
not qualified.
automatically, what I'm trying to say is because you're retired and collecting SSI retirement benefits, you
Yeah.
work long enough to qualify for Part A. Therefore, you are enrolled in Part A.
They put you there.
And they gave you your retirement benefits. They probably.
Right.
Yeah.
The Social Security will put you in A automatically.
I
Okay,
think the word must is
When
in.
you go to apply.
The word must is what's,
It
Yeah.
should be will instead of
Yeah.
must.
yeah, that's what. Thank you.
Or are.
Question 30, people with Medicare who do not qualify for premium-free Part A under their own work history may qualify for premium-free Part A under
First one.
How about the first one?
Right.
Are we all in agreement? First one.
Yes.
Question 31, which of the following is a preventative service that can be covered more than once per year for certain people with Medicare?
I picked the third one, depression screening.
no, it's diabetes.
No, diabetes.
It is diabetes. Depression screening comes once a year.
But
I
I,
believe the rest of these come once a year as well.
I thought in certain cases, people with higher risk will also be able to have screening mammography more than once a year. No?
We can look into that.
No, I don't think so.
I don't think so.
No.
But if they have it, would it be a preventive service?
No longer a preventive service at that point, it's diagnostic.
Right.
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 Question 32, equitable relief is a process whereby you can appeal about,
The last one.
yes. So equitable relief, to my understanding, is if you were told something incorrect by a Medicare representative or the Social Security Administration, and now you are all sorts of messed up. If you you can prove that you were told this information incorrectly, you'll be able to resolve your issue regarding enrollment into Part B. Question 33, outside of the public health emergency, which might a beneficiary only lose at the end of the calendar year instead of during the year?
Extra help.
Question 34, which of the following statements correctly describe the calculation of the Part B, Part D, and premium-free Part A late enrollment penalties?
3,
This one was a bit tricky. What did you think?
3.
Absolutely.
Hold it.
Dave, did you have something to add?
And what was the correct answer to question 33?
Extra help.
33,
Help.
Extra
extra
help?
help.
Thank you.
Question 35, for which benefit is eligibility based on the prior year's income?
Epic.
I
We're
put
all
all
in
of the
agreement?
above.
Epic?
Above.
No, it's all the above.
Epic.
Epic.
Because the Medicare Savings Program and extra help are evaluated at the time of application.
She's absolutely right. So Epic, I believe, is the only one that does look at your previous year's income and not your current income, as in right now.
Okay, question. So did you look at the question of the, they're going to look at it. They're going to look at it every year, right? They know your income tax. So they're going to look at you and write you a letter that they're throwing you off. Or because I know so many people who just like it, they don't hear from them year by year. They just keep enrolling. They don't have to resubmit applications for it. So
But Epic sends you a letter every year.
they do send you a letter and it says
Yes.
you're continuous, or you have to produce some other, we don't think you are. What does the letter say?
Says whether you're eligible and what the new terms are.
I get it. Thank you.
Question 36, beginning in 2023, for people that enroll in Medicare Part B at the following times, Part B will be effective the first of the following month.
All of the
I
above.
think it's all of the above.
All of the above, especially beginning in 2023. That's the important part. Not currently, but beginning in 2023, all of these will be true. Question 37, Medicare Part B rather than Part D can cover which of the following types of drugs?
I have all of the above.
Yeah.
Yeah.
Question 38, which Medicare beneficiaries living in New York State do not have the right to purchase new Medigap Plan C or F?
I have 3.
Absolutely, that is the rule. Beneficiaries who are newly eligible after January 1st, 2020 cannot buy that plan, either of those plans. You must buy the next best option. Question 39, people with Medicare that also have extra help are entitled to a special enrollment period that allows them to switch Part D plans, including Medicare Advantage plans, with Part D.
Last one.
The last one.
Absolutely. Absolutely. That is, I think we touched upon this earlier. It's once per calendar quarter, only in the first 9 months, so the first 3 quarters. Question 40, the following cannot be credited towards meeting the Medigap plan waiting period of up to 6 months for pre-existing conditions.
Last one.
Yeah, I had the last one.
Absolutely.
Wait, could you go
That
back to
means-
39 for a minute? I mean, after you finish talking, could you go back to 30, the other one?
So this one is absolutely correct because these 3 can be credited. This is sort of a process of elimination question. So a lesser Medigap plan, you can go into them. Sometimes we do advise individuals who can't get into the plan they want to try a lesser Medigap plan to write it out until they can get onto that greater Medigap plan that they're looking for. VA Health does as well, and national health plan from another country. I believe as long as you're working in that country. But if anyone knows anything else, I'd love to be proven wrong.
Yes, that's what you have to be working. You can't be retired in the other country.
Yes. All right, so moving back to 39, what was the question?
Okay, so what was my memory, something about the 9 months of the year, they can change, the first 3 quarters, but can they change? Is it like that the fourth quarter operates just like open enrollment? They can change then too, but it's the open enrollment period, something like that?
Yes,
Yeah,
yes.
so in that predicament, they're just like everyone else.
That's what I'm
subject to open
saying.
enrollment.
So that question seems, so the special enrollment period is the quarterlies, the first 3 quarterlies, but then they don't get a special one, they get the regular open enrollment if they want to do it in the last 3 months. Is that the point of this?
Yep.
Absolutely. It's not a special enrollment period. It's the regular one, just that everyone else has.
Yeah.
But the benefit of extra help is that you can use that personal special enrollment period to make those switches 3 times per year if you'd like to. Or up to 3 times per year. Question 41, if a beneficiary enrolls in Part B during the SEP while they are still covered under active employment or during the first full month of the 8th month SEP not covered through active employment, Part B would start?
Third one.
No, it's the second, but
Second one, sorry, I made a mistake. Second one.
Absolutely. As the beneficiary's option, either the first day that month or one of the next 3 months. Question 42, the IRMA is an additional amount that beneficiaries may have to pay for which Medicare premiums based initially on their MAGI from which tax year?
Third
Third
one.
one.
Third one.
Absolutely. Question 43, which of the following can you deduct or disregard from a married couple's income to qualify for the MSP in New York State?
I have none of the above.
no, it's the third one.
Help.
Absolutely. It actually is the health portion of their Medicare Advantage plan premium. You can deduct that from a married couple's income in order to, maybe that might save them and get them into one of the MSP programs.
Probably would save.
Yeah.
Vaughn, where did you
Yes.
find that answer?
Let me see if I have a route for that. Give me 1 second.
Because I saw a reference to premiums paid for Medigap or secondary insurance, but really nothing that specifically mentioned the health portion of Medicare Advantage.
So I don't have that at this moment, but I will write this question down, 43, and I will send an email at the end of this.
Great, thanks.
Stating exactly where I got that from.
Vaughn,
Question 40.
I'm
Yes.
sorry, is it also true that you could deduct the premium that you pay for a Medigap plan? I know you can for Medicaid purposes, but
I think I saw that somewhere, Dorothy.
sorry,
I think I saw that somewhere.
yeah. It makes sense. It makes consistent sense.
Mhm.
I haven't seen that myself, but I will definitely look for that regarding the Medigap, if you can use that as a deduction as well. 43.
I think it's somewhere in the definition of eligibility for MSP.
On the MRC website? Or where? Which definition?
Basically, any place you go, if you just Google Medicare Savings Program.
Okay, so I'll make sure I
Well,
find that.
They list $20, they list, a burial contract, but I didn't see a good reference otherwise.
Maybe the wording out there said you can deduct your health insurance, and it didn't specify one way or the other. And this question is just honing in on one type. But maybe
Yeah.
what we've seen has been just you can deduct the health insurance.
Right.
Question 44, which EPIC members have to pay a fee or premium for EPIC coverage?
Last one.
Last one, yeah.
Absolutely. Fleet plan members with partial extra help or LIS. Question 45, for Medicare beneficiary over 65 who is also covered under their own retiree plan and their spouse's active employment for an employer over 20 or more employees, which is the correct order of payments under coordination of benefits?
I got the last one.
Me too.
Yeah.
Yes. Absolutely. So especially because, like we can see, it is an employer for more than or 20 or more. So that's definitely counts as creditable coverage for Medicare. So that's why they're able to use that especially first, and then Medicare would come next, and the retiree last.
You know what
Question
question doesn't come up?
Go ahead.
Excuse me for a minute. You know what doesn't come up? When you have liability insurance, or umbrella or liability or car insurance.
Yeah.
So that always pays first, right? And Medicare, that they send the rest of the bills to Medicare, what they don't cover, and then Medicare picks up a bit, and then you are left with paying very little, or does it go to you? I would like to know the answer to that.
So when it comes to liability insurance, I believe liability insurance does pay first, and whenever it doesn't, they usually can send directly to Medicare, but I will confirm that.
I think the same with workers' comp.
Yes.
So they don't come to you first, those bills, and then you have to resubmit. I would love to know if it just doesn't.
No, it goes direct, Julie.
Okay.
I've been there within 2 years, unfortunately.
Oh, sorry. Okay.
Ooh. Question 46, the following does not appear on a beneficiary's Medicare card.
All of the above.
Right.
All of the above. This was changed, it seems like a long time ago now. They've gotten rid of all. Yes, it used to be your social security number, but this was changed a while ago now. They got rid of these because they looked too similar to numbers. I believe that was the idea. And question 47, the Part D coverage gap or donut hole begins when?
Where?
Second one.
The third one. No, the second one, I'm sorry.
It is the second one, when your total drug costs reach a certain amount. Question 48, the beneficiaries can request a tiering exemption from their Part D plan to have which types of drugs covered at a lower cost sharing level? Anyone want to take a stab at it?
I said all of the above. Any of
This is
the
the
above.
one. Second one.
It is
Second
not
one.
all of the above.
Number
Yes.
2.
Yes. So it would be a non-preferred brand covered at a preferred brand tier,
Yeah, okay. Yep.
but definitely not these two, unfortunately.
Yeah.
These drugs are very difficult to work with. Question 49. A change, I'm all over the place. A change in marital status, including divorce, separation, or death of spouse during the calendar year may impact on which of the following?
All of the above.
Yep.
All of the above, correct. It should impact every single one of these because your income will go down. You could not have to pay an IRMA anymore. You could become eligible for MSP. You could fall into a lower category, so on and so forth with EPIC as well. And lastly, question 50, beneficiaries with Quimby are responsible to pay.
The last one.
Yeah,
Absolutely. Services not covered by Medicare. This is another learning question or teaching question. Everything else that you see here is covered by Quimby. But Quimby will pay as long as Medicare pays. If Medicare doesn't pay, you're on your own.
Going back to 49 for a minute.
And back to 49.
Yeah, so just to stress here, because it's confusing also, you know, the Part B premium and the IRMA, what you pay is based on 2 years ago, which you can fight at the end of the year when you get the notice of what you're going to be paying. Going to say, oh, I agree with that, or I disagree, you can call Social Security and adjust it there. But this thing to be a little bit for the loop, because apparently, because you can, if something happens in the middle of the year, you're supposed to tell Social Security what's going on, and then it can affect it during the year. But the normal process of this is that they tell you what you're going to be paying come November, December. They send you a thing saying what's going to cost. So it sounds as if the change is being made every year based on 2 years ago. But if something happens like a divorce or a separation, then you have to tell them and make the change.
Yes.
Right, because otherwise they wouldn't know.
But no.
All right, so that's all, and I'm sure we've gotten, question 4 has not been answered. Okay, what did we miss? The answer for question 4, anyone?
Blue.
Blue.
Absolutely. I believe that Julie has the document for that among all of our notes on the
Yeah.
Google Drive. Julie, where can we find that on the Google Drive?
Probably, I'm not looking at it now, but probably under the notifications is a miscellaneous topic because it affects a lot of, or no, it's under definitely under the Medicare cost saving programs. There's a whole subject folder called Medicare MSPs, Medicaid, everything to do with cost saving is in one folder. So it's probably there.
Okay. So yes, Julie has that all uploaded right there. And so let's go down to the bottom and try that again. And 100%.
Okay.
So guys, that was the entire exam. I was wrong about that question. I don't know how I missed that one. I'll have to review that myself. But these are the answers to all the questions. We have until, I believe, a couple more weeks to complete it. So if you haven't completed the exam yet, please go ahead and do that as soon as possible. We don't want to wait until the deadline. And if you have any trouble logging in, please feel free to email Diane or I, and we'll put you in to be recertified into the system. And lastly, as it was stated in the agenda, if you haven't submitted your confidentiality agreements for HICAP volunteers, please do that as soon as possible.
Well, and I just wanted to make a point that I had in my notes on question 34. And it's not in, yeah, it's the one about penalties for A and B. So the answer is there's no penalty if you're a premium free Part A and you delay enrollment. But if you're not premium fee, then there is a 10% penalty. I just added that in my notes.
Absolutely. So this was a bit of a trick question because this sentence or this one phrase right here changes the whole thing. Because there still is, if you look at it, there still is a penalty, except 10% of 0 is still 0.
Huh. Okay.
So I myself actually got that wrong the first time, but I guess when it comes down to it, if you have premium free, it's essentially like there is no penalty.
I'm sorry, who's the person on the 914 phone number? Because I don't know who that is.
That might be me.
No, it's somebody talking. I thought somebody was talking. Okay, I thought it was somebody talking before. 914-838-13. That is you? Okay.
That's me.
I have to say that in all my years of Medicare advising, very few of any of these situations ever came up. I think they're obtuse, ridiculous questions, just to make it more.
Yeah, these questions this year, I don't know what they were going for, but they were definitely more difficult than previous years. They're going for challenges.
Hey, Loretta,
Yes,
you want to take over?
okay. I guess the issue now is open enrollment, and do we as a group want to plan to do about it? And I think the first thing that we have to concern ourselves with is who will do it and how much time do you think you can put into it? Because if we don't have people doing it, we can't do it. Or maybe we should discuss how we can do it first, and then you can decide. Okay, let me go to how. Obviously, we can do it the way we've always done it, which is live. We can go into the libraries, set up designated times at designated libraries. There's many libraries that have openly asked and others that have sort of indirectly asked, and I'm sure they would welcome a day or two, if not a day a week. For example, New Rochelle would love a day a week all the time, let alone open enrollment. But we don't have people to do that at this point in time. Another alternative is to take an approach where we collect the information offline or by having them handed in when we are at a library, or email it to us somehow, or some way, information offline, prepare the plan finders offline and email them back to the client, okay? Maybe we just collect it by email and email it back to the client, and we can collect it through the helpline email address for all that matter. Have that. I don't know.
Except for those who don't have an email address.
For the clients that don't have an email address?
Yeah.
That's true. The clients may not have an email address, but the alternative to that is to collect it by hand. And then if they don't have an email address, we have a different problem, which is how to get it back to them. Because then we're involved in printing and paper and mail. And that's a cost to whoever's doing this, which may put a damper on that whole thing. So
How are you gathering the names of people that need help in the first place?
well, gathering the names of people who need help could be asking the libraries to put up another poster, or putting it on the website, or publishing it. You know, if we know what we're going to do relatively soon, we could get the word out that this is the way we're going to do open enrollment. I think Julie has a network, let's put it that way. I think we can manage to get the information out if we decide soon how we're going to do it.
You know, I would favor something like that second option you described, because there's nothing more annoying than sitting in the library and having nobody show up. Whereas if we had a list of people who needed help and had either their phone numbers or their email addresses, most people do have email, I think, at least that's been my experience.
Yes.
And with those who don't, I mean, I don't mind, putting information in the mail to people, but that way we'd have specific people who really need our help. We could, agree to take certain days of the week where we get the names that you collect, or whoever collects. I don't know. I've been working with Diane Punai this past year, and she gets the calls in and she just disseminates, to the various volunteers on various days of the week. And it has worked really well.
I have not gotten a call through Diane that the person doesn't have email or access to email. So I
had a couple, but then I just mailed back.
Michelle?
Yeah, I think there's two things. During the COVID, the past couple of years, that we were doing what was very similar to what people have been doing with Diane Punai. I will say in each of those 2 years, I think I only remember one person who didn't have any access or didn't have a daughter or a son or somebody to get them to send it. And so it worked really well. The
Great.
other thought I had was going possibly, and this becomes an issue, a big question mark, because now I'm reading this morning and throughout the weekend how much COVID is coming back, and the form it's coming back in is so contagious. But if would we ever want to think about, instead of signing up for a weekly, and I could involve myself in this and come down for a day, say, pick a Saturday in northern Westchester at Shrub Oak and have counselors there like we've done in the past, and then another Saturday for down county, or 2 or 3 of those. Would that be easier? Because I look at how many people we have, and it's going to be hard to cover libraries every day as they're assigned, the way we used to do it. So I was thinking about group, as long as we can have a group, then that's COVID dependent.
As opposed to what we were talking about earlier, right? As opposed to gathering the names and email.
Right.
And
yeah, that's one option. Or, and then if you think, is it worth to try to bring to have a 10 to 2 or whatever in, let's say, Shrub Oak on a particular Saturday, and see how it works. I'm just throwing that out as an option. The phone thing worked great for me. I can't tell you how good it was.
no, in fact, I kind of prefer it because you can do things in your own time.
True.
There are definitely advantages. Dorothy's saying something that's really true. You can do it whenever you want. You could sit down and do it for 3 hours and get 5 or 6 of them out. It's not, it isn't
Right.
an issue. But I was really sort of assuming we'd do both.
Yeah.
We would do live counseling for as many people or for as many libraries to handle, and then collect the information, and either the same people or other people handle it. The collecting the information is very new. How many people will hand it in or not, I don't know, but I have a feeling there are a lot more people that will be willing to do that. I mean, it's easy to do that, and for the people that are capable. Christine?
I have a preference to do in person, and I would like to continue in Yonkers, since I've done that for 14 years, and I'm happy to, continue that. But I can only do it on Thursday, so I assume we'll be open on Thursday there.
Well, yes, I mean, we could do every Thursday in Yonkers. If we had volunteers, we could do every Thursday, or doing every other Thursday in Yonkers.
Okay, that would be my preference, and I could do every Thursday during open enrollment, but I couldn't, I'd need somebody else there as well. But that would be my personal preference.
Yeah, Christine, I could join you.
Okay.
I think Alan Houston would be, or Houston, whatever his name is, he would be very happy to do that. Can I say a few things here now while we're talking about this? I agree with the hybrid, that there are different situations you can approach it, but I must update you of what I've been doing for the past 2 weeks. Every single library has been contacted in person by me that we want this program, and they are total. And if you look at the documentation under the lists, you'll see every single one. I've sent them the latest version of the press release for it, and they know what's happening, and they've okayed our calling them, and we've okayed laptops in absolutely most cases that they would. In fact, one library, Bronxville, went out and arranged with WLS to get 2 Chromebooks that we could use. They didn't have them before. They did that. So 100% on the libraries, they're done, they're finished. Every library would allow us to come in and counsel on a one-to-one basis if somebody calls in. The other thing I've been working on this week is contacting every single community senior center. And I've been more than halfway down that list. And certain people have really gotten back to me. Certain people said, absolutely fine, thank you so much. I'm telling my club. And this is not only the senior center, but the rec department sometimes. So the outreach that I've been doing purposely to push this whole thing through is the effort has been made in the past 2 weeks. And we don't know the result of that yet because the holiday was in between and I'm not quite finished. I have half more of those centers to go through. Those are talks and emails and documentation sent to them. So, and then I'm going to talk with Krishna later about if we can have some bookmarks and they would put those out. So the enormous, I have to report the enormous reception of the libraries as a whole and so far so good with the community centers more than willing to tell people in their clubs. I think we might get a flux of it. Now, that's the background information. The idea I propose here is another one. I agree with Christine, of course, and David, and every Thursday, and Will, that's great. So could you just say, before we close off that topic, could you say, when you say during open enrollment, would you like to start that in the beginning week of October? So it would be October 6th, so that it would go through October 6th, 13, 20, 27, November 3rd, 10th, and 17, end at Thanksgiving, because by then it's too late. You know, after Thanksgiving, it gets too late to make changes, but I would.
True. December 7th.
December 7th, we go till December 7th.
People who wait that long.
And we don't start until October 15th because we don't know when we're guaranteed to have the new rates there.
You don't know what?
We know the new rates will be in on the 15th. We don't know they'll be in on October 7th. So we don't want to tell people we're doing open enrollment for them too early.
So October 13th is the first Thursday. I suggest opening it there and not missing it by 2 days.
No,
We can't do open enrollment on the 13th if the new rates aren't there. Michelle, are you?
totally agree. And actually, I have found in many cases, and I've always done this as a test on my own plan finder, is I go back even into the 1st of November and I find additional information has come way past the 15th. So before the 15th is definitely a no. You won't have enough information.
You have to have the plan finder always set for next year.
Right.
Yep.
Did someone say Bronxville Library was the one who ordered the new laptops?
Yep.
Because I would be willing to work in either Bronxville or Will also 1 day a week.
Yeah, that's what I was hoping, that people who are living in these communities would just make an arrangement, either 2 of the days, just to tell me, and either I'll pass you the person. They know we exist. They know we want to help people. They know we're out to help seniors during open enrollment. You can set it up in your own community. I could do Croton and say, look, I'm going to be available in Croton on certain days. I think that if we spread the load of this communication business and let people establish their own, I've already laid the groundwork all through Westchester. They know who we are. So you just set up your own little pockets of where you want the arrangement and how frequently. You may want to rotate. If you live in the middle of that down county thing, you may want to do large, I don't know how they're located, but Larchmont one day, the next week do another one. You know, attach yourself and talk to them.
I could do Larchmont and New Rochelle.
That kind of thing. But do you want to make the arrangement yourself with them and say, I'd like to set this up, but I will be.
Okay, I'll call them.
All right, so I'm going to write that note that you'll.
Wait a second. I think this is getting a little out of hand. If we have everybody calling whoever they want to call, we're going to get only, the libraries in our communities handled, and not the libraries that necessarily need more help. And that one person is going to get their own volunteers for the library as well.
Yeah, that's what I said, a hybrid methodology. I agree with the main centers that everybody was talking about before, like Yonkers and all that. on a regular basis where groups of people can help. But I would absolutely encourage people who have their own community relationships with their libraries to help, to reach out. Because why make people drive lots of miles if you can get our services closer to them, up front in their face, in that library? It's not fair to make people just drive down to Yonkers if they live in Scarsdale, or even higher, Elmsford. It's not fair.
You have to go where your clients are. You know, I mean, there's no point in going to a library, as many people have said, and sitting there. We know anyone is going to come to Larchmont because we've never been in Larchmont or Mamaroneck or wherever. We choose to go because it's convenient to us. We do know that there are going to be people in New Rochelle. Okay, we do know. I believe that there would be people in Greenberg if we went to Greenberg. We don't know if we're just, you know, we just show up at a library that there are going to be people there. And then it's pointless for us to sit there. It's
because you're arranging with the librarian that you would be available. Could they please publicize in a newsletter that you're available? And it's up to you if you want to do it. Nobody's telling you to do it. If I say I'm going to Croton, I will be available, Croton, sitting there, nobody shows up on a Tuesday, 2 Tuesdays in October. That's my commitment, but it's my commitment to my Croton community and perhaps us, that I'm willing to sit there and help people even if nobody shows up. We shouldn't say no to that. That helps people get it closer to them. On top of the other situation of the mail-in stuff and the thing you were talking about before, of those major centers like Yorktown, obviously it's a major, Yonkers, it's a major center, Yonkers. It's always been there. It's been twice a week, and you have more than one person going to man it on those days every Thursday. But branch out. It's only fair to these places that have lost us.
How are we going to coordinate this? Does everybody want to send? I mean, does everybody just want to do it on their own?
No. Yeah, you just set it up, do what you want. All the information is documented in that joint list that everybody can see. It has the contact information. It has what they're willing to do in the notes on the right-hand column. It says who's the one to speak to, whether you need to go to the reference library or specifically to a specific person. We've documented every single thing. We can look, you can share screen on that. So if you wanted to look on that list just for the libraries, everybody can go to that list, see who they're supposed to contact. That's the person who has deep knowledge of it because they've got my press release. And say to them, hey, I want to help your community in October 15th to December, whatever, no, October 20th to December 7th. I am willing to sit in your library. Would you put that in a newsletter, or could we put a bookmark saying we're available for walk-ins at that time? And the librarian is going to say yes. They are fully aware of us. Guaranteed they're going to say yes.
I have 2 questions. I have a question for my Shrub Oak and my Yonkers team. I'll do the. I've heard basically from Dave and Christine and Betsy indirectly that you're willing. Are you willing if we go once a week during October to December? Do you think we could man that with the 4 of us? At least 2 of us at a time?
Yeah, I'm willing to.
Yeah.
And Dorothy? Okay. So if the 5 of, Betsy, did you want to say something?
Well, I want to see whether I can do it, you know, closer to home, like in Larchmont or New Rochelle.
Okay, my next question was how many people from
Call is being recorded.
from that team would be willing to do it once a week in New Rochelle, or maybe once every other week in New Rochelle? Or maybe we just do it once every other week in Yonkers and once every other week on the odd weeks in New Rochelle. So the 1st and 3rd in Yonkers and the 2nd and 4th in New Rochelle.
That would be fine for me.
Would it be a Thursday? Because I'm only available on
Right,
Thursday.
right. That's
Okay.
what I'm thinking. I mean, I know you said you're only available Thursday, but
right.
We took our team and did 1st and 3rd in Yonkers and 2nd and 4th in New Rochelle. I mean, they're like 3 miles apart. Let's face it. I mean,
right.
Not like they're 100 miles apart. I mean,
Right.
in Westchester, you don't even get to the grocery store in 3 miles, so,
Yeah, no, I wouldn't have a problem with that.
I would have.
okay.
it's fine with me.
So we'll consider ourselves a team and we can offer once every other week service to those 2 libraries.
Mhm.
Okay.
Are you going to communicate personally with the 4 of your emails or through SBIC media, the Google group? Because other people may want to join you if you see what's going on in the conversations. Which way do you want to communicate with each other?
Well, we have our own group, so we'll communicate with the group. I mean, if somebody wants to join our group, that's fine, but
Okay.
Yonkers group, and we have a Will group just for that purpose.
Okay, I will tell you that I'm doing demystifying on so many days, 11, 12, 13, 20.
That doesn't affect us. That doesn't.
No, I'm not finished with my thought. Because I'm already in certain libraries all those days, like huge number of days, I'd be willing to say I'm coming 2 to 3 hours earlier on every single one of those days and sit there in case somebody wants to walk in. I would set that personally up with the librarian because it's no skin off my back. I just go earlier and see if anybody wants personal attention. Unfortunately, I wish they'd heard the presentation first and I sit there afterwards. But since it's always late at night, most of them are late at night, the library's closed. So it has to be before. And then that would be my contribution, not on these that you're talking about, but doing 2 or 3 hours sitting before each one of these or after, depending if it's a weekend. I'm doing 20 of them.
Okay. Let me just get back to the Shrub Oak group. Now, Bob, Linda, and Mary Ellen, and myself, are we, and we'll include Jeff in, he's not in on the call, but are we willing to say we're going to go once a week to Shrub Oak?
Yeah, I'm available. Are we gonna do twice a week, like we do now?
No, twice a month we do now.
I mean, twice a month, I'm sorry.
You want to do twice? That's what I mean.
Oh, so you want to do
Do you
once
want
a
to do
week?
twice a month during?
You want to do once a
Or do
week?
you want to up it to once a week during open enrollment?
I do have one Tuesday a month that I can't do it, but I can do the other 3.
And I can do, all during the open enrollment, I can do Shrub Oak.
Okay. So between you and I and whoever else wants to join us, we can do Shrub Oak.
Miss Mary Ellen, I'm willing to do it weekly during open enrollment.
Okay.
How about as far as the equipment is concerned?
Okay, wait, let me,
The
okay,
laptops,
as far as the equipment is concerned, now Krishna will correct me if I'm wrong, but in Shrub Oak and Will, we're absolutely set because the equipment's there, it's working. I can go over, set up.
How many laptops, for example? Or Will?
In Shrub Oak,
Because
we
that-
have 4 laptops. We have 4 in Will as well.
Oh,
Depending upon where they put us, we may have access to their computers. The issue with their computers is so far they haven't been able to connect it to a printer. Our laptops are connected to a printer, or we can connect our laptops to our printer. But we will have them. Which ones we have, whether we have the Chromebook or the PC, in Will is dependent. In Shrub Oak, it'll be the Chromebooks. And I spoke to Krishna already. If you need, or if we can manage to coordinate it, in theory, we can take the Chromebooks from those libraries because they are WLSs and use them in a center if we need to. But we have to bring, the person that does that has to bring them back because they're going to be used the next week. Every Tuesday, the Chromebooks in Shrub Oak have to be in Shrub Oak, and every Thursday, the Chromebooks in Yonkers have to be in Yonkers. And as far as New Rochelle, I will find out. I know they have at least 2. I will find out if there's available for more. There used to be like 4 in that room. They remodeled. I don't know what's in the room now.
I have a question. Is
Yeah.
Bronxville off the table? Because I'd be willing to do every other week between Will and Bronxville.
You can do Bronxville, but I'm not going to get involved with Bronxville.
Okay, so then should I do it the way Julie was suggesting, just set it up with them? Is that okay with you, with all of you, the powers that be?
There's no powers. We're all in this together. And whatever you can do to help residents of Westchester County is where when I had this idea of setting this thing up, I want us to reach them because they can't travel as easily.
Where is this list
I
of
wanna-
contact the various libraries? Where is
I'm gonna
that?
I'll work with you. I'll call you later. I will talk you through it's listed online already. It's always been there.
Okay,
Just
maybe,
everybody who wants to do these private ones, just let me know because you can't add information to that spreadsheet. Only me and Loretta can add information. So I will add your information and as soon as you tell me what's going on, so everybody can see what's happening everywhere.
I think before open enrollment, we should gather everybody's information together into one piece of paper that we can send to people. So that they, I mean, if the library is putting something out, we could put something out saying, this is when we're in Will, this is when we're in Shrub Oak, this is when we're in New Rochelle, this is when we're in Bronxville, this is when we're in Larchmont. Yeah, we could, so that people have a choice, or if they're not in one of those communities, they can get to the closest one or the most convenient one. Plus, we do have to still work out. I think we should do the offline one. It seems like people are willing to do that. And that is probably better suited also if you go to a community center, because you can go to the community center, hand them a piece of paper, collect it at the end of the session or collect it the next week at the community center, and then distribute it through the community center, because that's, even if they don't have email, that's an alternative. So if you want to pick up a senior center like the Larchmont or Mamaroneck or Rye or whatever, Bronxville senior centers, you can do it that way without necessarily having to have you and somebody else at a library to work with the people live.
By that same token, you could set up a Google Meet with them and let you do a share screen.
They don't, they're not going to do Google Meet. So.
Well, I have deep experience with communicating with seniors for taxes, deep personal experience with, and you talk them through, sit there calmly, say, press that button, you see their screen, they see your screen, and it does work. I've been doing it for 2 years. So some people can do it.
Julie, the people in this room have to feel comfortable doing that.
Everything that I say is very individualized. Everything I say is individuals. I know there's people on this phone machine that did do taxes. That's why I'm saying it. Just do your capability and what you think you're willing to put out, but spread it so that it's wide. That's all I'm interested. There's lots of different ways to do this. We don't have to be locked into civic centers. We don't have to be locked in any single way. I mean, as long as we're certified, HiCap certified, and we've gone through the studying. You know, I want to keep it very broad.
Oh,
You have to let us know so that we can make a master list of by August. What date do you want to get solidified by?
Well, if we plan to put a list together and get it to the library so people know about it in the libraries by the beginning of September.
Okay.
So we should go to, I mean, I'd be willing to go to the Larchmont and New Rochelle and tell them when I'm available, and then I'll get back to you, Loretta, and tell you.
Right. I'll get to New Rochelle this afternoon and see if Thursday is good for them. And maybe we could do, as I said, we could do Thursday in New Rochelle or Yonkers. If it isn't good for them, then I'll just touch base with all of you to find out what another day is. I mean, New Rochelle is, I think the clientele in New Rochelle is probably more people that don't have access to computers than, for example, a Larchmont, where more people would have access to computers and email. It's also, you know, every community is different, and you tend to get, in New Rochelle, we tended to get more Medicare Advantage and Medicaid types of issues as opposed to just Part D drug plans, which is what we get in Shrub Oak primarily. If we had to categorize it. So it's, you know, every community is different. So I will ask New Rochelle, and I will find out if we can alternate the Thursdays, like we said. And then you could work from there for Larchmont. And if it's not on Tuesday, I can come and work with you in Larchmont as well,
Okay, I'll try for that.
doing it live, okay?
I guess at the risk of belaboring this, if we have too many people at Will Library willing to go to Will Library every other Thursday, then I could commit to once a week at Bronxville. And how will we know whether we have enough people for every?
I'll put you on the list and we can see if people can, the list is out there. The list is out there for Will for the rest of the year. Okay, so there are people signed up already for Will for the rest of the year. And I mean, I'll send the link out. Will, I will call New Rochelle right after this meeting is over.
Okay.
And again, as I said, if we're going to do every other week in New Rochelle, then we're free to do Thursdays at Larchmont or Yonkers too. I mean, the same group can work whatever libraries are appropriate. Maybe we could work it into the same spreadsheet so we can all, 5 or 6 of us can, get together. George, I see you there, but I haven't heard you. Are you going to be able to join us for open enrollment? No, you just muted yourself.
Oh, yeah. Yes, I'm listening here. I was going to email after the meeting since we're part of the group, but yes, I'm still willing to go. But, the summertime, you're not around as much. I wasn't around in July for this first Thursday, but for August, if people go August, I'll go August. And because the drive is locked up, I was trying to put myself on the schedule, but right now, I don't have access to it except for Reed, but I'll email you.
Okay, yeah, I'll email you the link. You should be able to get in. But we have a pretty good group, pretty big group, and we can add other libraries to that and see how it works out. Other down, lower Westchester libraries to that.
Yeah, and I've been to New Rochelle many times with Betsy and the other folks, and I'm willing to go back to New Rochelle. And if Bronxville is added, that certainly would be easy as well. If you needed a second person there.
Okay, so we're talking about adding Larchmont and Bronxville to our group and arranging for Thursdays, potentially for Thursdays or initially for Thursdays for that group, and Tuesdays. And we still have a few more days left in the week, so we'll see.
Is Jeff Painter, he's not here today, but is he the one who's in charge of doing what you're doing for Yonkers? Is he doing in Shrub Oak or are you doing?
I am. Jeff does not want to be the lead in Shrub Oak, so I'm the lead in Shrub Oak.
Okay, so which people are, Mary Ellen, you had mentioned to me at some point that you would be willing to do a number of libraries up there. If we discovered a consortium going between Ossining or, Katona is crazy for help. They want things, but that's too close to Shrub Oak maybe. But there are so many libraries up north that are so willing. Montrose Library is amazing. They like programs. They have small rooms. Is there a group of people who'll be willing to work this kind of activity up in the north?
I can't go that far, Julie, and I can't commit right now to anything because of my other commitments.
I knew you didn't, but Mary Ellen had said she could cover.
Oh, Mary Ellen. Okay, I'm sorry. I'm Mary Ann. Okay.
Yeah, we saw each other in a doctor's office by mistake. I hope she's well with her eyes. Yeah, and she said she'd be willing to go to no more than one. So there are more than one. Linda is in Ossining. That's another library that, what's his name? Trapasso. I'm sure it's easy to set up. So a combination of places like a consortium for the northern and do a rotation on the north. Is there anybody willing to do that?
Julie, we have our own meetings on Tuesdays. We'll discuss that among ourselves tomorrow at the meeting.
Okay.
Okay.
Yeah.
Linda, Mary Ellen, Bob, I'll send you a link for our Zoom meeting tomorrow.
Thanks.
Okay,
I'm working at the library tomorrow morning, so.
okay.
And if you add me into the mix of that group, I don't want to be on your email list right now. I have too much going, but if you consider that I'm a Northern Westchester person, and if you want to establish something at a Montrose or Ossining or Croton or anything in that north thing, I could fit that into my schedule.
Okay, well, we'll keep that in mind.
Okay.
So we're done for today?
Do you want to meet in 2 weeks or 4 weeks?
4 weeks.
I would
Okay.
say 4 weeks as well, since it's the summer.
Mhm.
I think 2 weeks is in July and August is too much.
Can we shoot for having a decent first cut for the fall then? Can everybody sort of in 4 weeks work out where they might want to work or do open enrollment or their own little individual projects, as Julie's suggesting, and then we can merge in 4 weeks?
Sure.
Sure.
Good, okay.
Whenever you set anything up together or by yourself, just email us so that we can add it to the thing and see how it grows, right? And you'll see it in the notes.
I'm willing to help out wherever in Northern Westchester. As I told you, Julie, the only one I would not be willing to work at is Peekskill because there is no room and the lighting is horrendous in the gallery.
Yeah, I agree
And
with you.
after what I've gone through with my eyes, I'm not going to risk it by going to Peekskill.
Montrose is so much fun, and there's other places that are good. So that if I worked with you, it'd be great, you
Okay.
know. do that
And if
with
you need help before you're doing demystifying, if you're going early,
Yeah,
for some of them, I mean, I'd be willing to go with you.
Perfect, because I
so you
have,
support.
the trouble is I'm going to do it on the days, because of my scheduling of where I put these demystifying, it's going to be earlier than what you're saying, but at least we can answer some basic questions.
Right.
We can set it up and then follow up with them later if price changes later, but at least we can have that in-person conversation with them I'll send you the list of dates.
Okay.
I am.
Just one, how many people here are willing to do the offline stuff? If we start collecting stuff, Dorothy and Michelle?
Oh, wait, what do you mean by offline? What?
I mean, collecting the information and then somehow getting emails to you or.
Yeah.
And
This is Mary Pfister. I'm willing to.
I think.
And George Cater, I'm willing to, sure.
I'm not clear on what you're.
What I'm asking is, we talked about collecting information or publishing that they information via email. And we would then turn around and send them the Plan Finder results back via email. Or conversely, if we go into a senior center, collect the information manually and then deliver it back to the senior center a week later.
And what information are you talking about, Loretta? Are you saying getting their drug list?
Yes. Basically, their drug list and their zip code is all we need.
Right.
Doing it how? Doing it how?
By email.
Oh.
Michelle?
Yeah, I think it's a little bit more than that. Income plays in there. Are they a veteran? If we go back to that old questionnaire, we should really have used that, and then with their drug list. But I'm willing to do that. You know, as many as you can send me.
Okay. We obviously we need their telephone number because if there's a question, we have to.
Of course, absolutely. That's on that form. Yeah.
Yeah.
Yeah. You
So
have
that-
to have the phone number.
So then we would present the person with several choices when we finished, you know, with the Plan Finder, is that the idea?
We would present them with the Plan Finder output. I mean, Plan Finder output is several choices. I mean, if they're looking for a part plan, it's probably the first 3 on the page. If they're looking for Medicare Advantage, it's a little bit more complicated and a little.
Exactly.
So Loretta, can we do that legally?
What do you mean, can we do it legally?
You know, as far as transmitting drug information on unsecured line?
Is it HIPAA? Is there a HIPAA?
Yeah.
And
They've
They're giving us the
given us the
information.
information.
Yeah,
It's-
so that's
We're
not
not
HIPAA.
violating anything because they're giving it to us
Right.
to then help them find a plan. It's
And
not,
then we're sending it back.
yeah.
Yeah,
I was
but
just
you-
wondering.
Yeah, no, that's not a HIPAA problem.
Okay.
So are you asking, are we willing to do it in that manner? But who gets the information? How do you get the information in the first place?
Well, I think that's part of the, when we publicize this list of, we're going to do it live here on these days, we'll say, and we also have a feature for those of you who can't go to the library to send us this information via email, or maybe we could, attach a form that they can fill out and send it via email, and we will send it back to you, send you your plan finder results back. And if we're going to go to senior center, you can, do that one-on-one with them. But if you go to a senior center and they give you 100, 100 people show up and hand this to you, you'll have the group to fall back on to help you with it. I mean, that might be a bit much to get done in a week for,
Loretta, would these emails be sent to you and Julia, and then you disseminate them, or what?
I'm seeing that before you say answer that, I was going to say not a separate form, just use the helpline, puts everything to the helpline. That's the way you can control it. And then you can find out if they want to have this service. You advertise it exactly the way you said, that there's a capability of doing this online stuff. But then when we get that first phone call through the helpline, not have a different way of communicating with us, just always everything through the helpline. That's the only way we can control anything.
That makes sense.
Yes, it does. I agree.
We can use the email from the helpline. Okay, there is a user ID associated with the South helpline. We can use that email for this purpose. Okay, and I could just say, I mean, if it becomes too difficult for all of us to log on to the helpline to get an email out, and if that's too confusing, I can disseminate it. I could hand it out, parcel, whatever you want to say.
Loretta and Julie, I think we also have to keep in the back of our heads that there are going to be, maybe because of COVID, people who will not want to come to the library.
Absolutely.
So that needs to be brought up as, here's your option if you don't want to go to a library.
Right.
That's always been exactly right. I agree with you. And it's always been written in the way we publicized it already.
Okay.
Call online. If we can't help you online, we'll try to arrange something with you privately. But first thing is call the helpline and see if we can handle your problem.
Right.
All right.
I'm going off.
Okay.
Since I don't know where people live, I'm going to send you in an email to the group a list of where demystifying is at the time slot. And especially for Mary Ellen, because she said so. But if anybody wants to attach themselves to 2 or 3 hours earlier than that demystifying, please let me know. I think that's the best way to poll the place to see if anybody's available. Like I'm looking at Mount Kisco on a certain day, and that's up your area, Bob, right? Mount Kisco. I'm there on Tuesday, the 11th. If you could be there in the library for the few hours before with me, it's well, I know that I'm doing, on Tuesday 11th, he's already covered that day. He's already.
We don't.
You don't know. I'm putting out that list. If anybody feels in their schedule that they can attach themselves for the 2 or 3 hours before the demystifying, I'd appreciate you getting back to me. If it's not, I'll do it maybe on my own or maybe not, but at least it's there as an option, right?
I have a really dumb question. Which is the helpline? That's not the line that call in for Diane Punai, is it?
No, we have our own, which is part of this whole. We have our own helpline numbers. Okay, Julie has North, I have South. They're just two numbers, and people can leave us voicemails just like they leave for Julie. I mean, just like they leave for Diane.
Yeah.
We have this. It's not the same system, but we have
same idea.
Yeah, we have emails with the transcription and the recording, and we handle them or give them to someone else that's associated with that library to handle. So they can either leave calls in that way, or they can send emails directly to civiccounselors@gmail.com.
Got it.
Dorothy, you can see, I put the copy of the latest version of the press release that I wrote. I put it in the folder called promotion on our website.
Okay.
Look in promotion, you'll see it. You can print it out. That's what you can tell people. It's been there. And it has the helplines there.
Okay, thank you.
I guess that's it. You've been great.
Okay, till 4 weeks from now.
Yeah.